Yeah, what's interesting is that, most people don't know it that, and Dr. Greenberg, correct me if I'm wrong, Alzheimer's is like the sixth leading cause of death in the US. It ranks up there. Am I
Hmm.
incorrect? Please help me.
It ranks up there. I'm not sure that, of the number six.
Yeah, I know it's up there, and most people don't know that. Like what happens is what's traditionally happened in families, especially in a lot of underexposed to the details of it, is that once something happens, we tend to kind of isolate those people with those conditions,
Hmm.
and just put them in a bubble. And that isolation with aging plays in, so it's not something that's readily discussed. So when Dr. Greenberg was talking about the early onset, a lot of people won't even take that into consideration.
Yes. Dr. Greenberg, do you feel that patients who have dementias outside of what people would expect have a little bit of a harder time getting a diagnosis? And Doc Griggs, I'm gonna throw also the other end of that to you. How do people who don't fit into that box have trouble navigating them and their family, have trouble navigating the healthcare system to get to these diagnoses, right? Because it's one thing, I think, if Nana's 88 and has some memory problems, people kind of think of that as maybe acceptable or normal that I'm bringing her into the doctor to say she has memory problems. But if at 45, 50, dad is having some memory problems, like that's more complex. How are people having to navigate that space?
Well, let's just start with the fact that most you're going to deal with denial first, and you say you deal in the acute care situation. Am I really? First of all, if I am having problems with memory, am I going to tell anyone? And
Mm,
how bad does it have to get for me to actually go to a healthcare provider, a doctor, to be seen and screened about it? And again, particularly in men, as the three of us know, we'll go lay down, or we will take a nap, or how are you? I tell people that fine and good are four-letter words that need to be listed on the kindergarten list of bad words not to say in your life, because those words have contributed to the tragic end of a lot of people. What did the doctor say? Everything was fine. How do you feel? I'm fine. How's your memory? I'm fine. And then the other thing is that once something is diagnosed or started to be investigated, again, I'll start with men as the model. I hate to do that, but people won't go back to the doctor to follow up. And by then, it translates to a care burden. These diagnoses, Alzheimer's is not just a diagnosis for the patient, it's a diagnosis for the family and all those that care about them. So there's a financial burden, there's an emotional burden, and I could just, I'll wait for other questions. I'm sorry, Dr. Greenberg.
No, no, that's fine. And it's a progressive disease, which is it's a devastating diagnosis because the people will stay alive for a long time and become diminished as time goes by. And just the prospect of not being able to recognize your family members, the people who you love, the people you interact with throughout life, is devastating. Um, the other most common forms of contributory pathologies are vascular dementias. And that's the most common mixed dementia. There are others as well. Lewy body disease is also a common mixed dementia. And the admixtures differ depending upon your ancestry, which is also plays into how the diagnoses are made. It ties into access to medical services, cultural issues. It ties into your sex, your biological sex. So, for example, the most important genetic risk factor is referred to as the apolipoprotein E4 allele in the ApoE gene. Uh, But if I have to be an ApoE4 carrier, I want to have a Y chromosome because it's much more severe in women than it is in men. It's less severe in African Americans than in whites of European descent. So these are all issues that play into making a diagnosis, the multifactorial variables that need to be taken into account. And it's not just memory loss, it's functional loss. And it's the progressive functional loss that goes into that diagnosis. There have been fabulous, fabulous advances in the field of biomarkers for Alzheimer's disease. We can do brain imaging now that tells that will tell us in life whether or not the pathology exists in the brain. There have been important advances in blood based biomarkers that are not yet ready for the clinical diagnosis to be made because it's still new enough that there's enough variability from location to location that you can't rely on that as a sole diagnosis, but that's coming. So these are all things that will be more feasible, and the critical issue is, and this was one of the themes that I was told we were going to be discussing, early diagnosis. Because the earlier the diagnosis is made, the more that can be done to prolong the disease decline.